WCNC Charlotte. This is Flashpoint, where power and politics collide and the tough questions get asked and answered.
Thanks for joining us here on Flashpoint. I'm Ben Thompson. Charlotte is facing a number of public health concerns right now. Mecklenburg County once again in the high zone when it comes to COVID community spread. Lots of folks masking up again. And monkeypox growing too. Right now, Mecklenburg County has half of the state's current cases. Joining us today, Mecklenburg County Health Director, Dr. Raynard Washington. Doctor, thanks for coming on. We appreciate it.
My pleasure.
All right, let's begin with monkeypox. In terms of vaccinations, where do we stand as a county?
Right now, as a county, we're in a much better position than we were just a couple weeks ago. We were fortunate enough to receive an additional 2,000 doses on Monday. And so that certainly helped us with our supply, and we're working as quickly as possible to get those 2,000 doses administered throughout this week and early next week, and expect that we will continue to receive shipments on a routine basis now. The CDC has released sort of a phase 3 of the vaccine rollout, and so we're expecting our volumes to increase. And so we're working as quickly as possible to vaccinate as many people as possible. That being said, our supply is still not sufficient for our demand. We have well over 2,100 people on our wait list as of yesterday. And so we're working as quickly as possible to get folks into the clinics that we have across the county.
And by the way, shout out to all the workers at the health departments, because I mean, I've talked to them, I've seen them, and they're doing just a fantastic job. The U.S., it seemed like, jumped from dozens of cases to thousands in a short amount of time. And some have criticized the federal government's initial response as being too slow, too flat-footed. From your specific vantage point as a local health department director, do you think they were too late to respond to this?
I don't necessarily think they were too late. I think as with any response, as we saw with COVID response, there is a window of time it takes to operationalize response. And to activate various components of the response, and to learn sort of specifically what's happening with the outbreak on the ground, which is helpful information because this outbreak could have been impacting any different types of subgroups within our community. And so I think that the federal government, state government, and certainly here locally, we operationalize and activate it as quickly as possible. I know we began our planning locally well before we had our first case. And so we spent about 3 or 4 weeks activating an incident command structure here locally, as well as preparing for various aspects of our local response. And so it definitely takes some time to get started, but certainly I think all our engines are firing towards containment at this point, and we're very hopeful that we'll reach that point.
Mecklenburg County right now has half of the state's cases. Any reason you believe that that's the case beyond just the fact that we're also a populated city?
Yeah, so I think certainly our population specifically is one of the underlying driving factors. We are a densely populated urban area. We believe, based on not complete estimates, but some estimates that we have of the size of the LGBTQ population here in Mecklenburg County being greater than potentially some other counties in the state. And so, of course, because that community is being most impacted right now, certainly we would expect that there's more risk here in Mecklenburg County compared to other jurisdictions.
I want to get to the gay and trans community, because I know there's some big questions there coming up in just a minute. But first, should the general public now be concerned about getting that vaccine, or we are not yet at that phase?
Yeah, we're certainly not at that phase. You know, I know the number 39 is a quick jump from where we were, let's even say a week ago. But certainly we still have low enough transmission here where I don't believe that there is a huge risk to the general public. That being said, there is risk. There is some risk. But the biggest restriction we have right now related to vaccines is our supply. And so I know our federal partners are working with the manufacturers to procure more vaccine for the community, for the entire country, but specifically to be distributed in communities. And so once we have an adequate supply, and I know that that's going to take several months, it's not going to be a very short period of time because it has to be produced. And so we're anticipating that will happen over the next several months. But until that time, we will have to continue prioritizing individuals most proximal to the outbreak and at greatest risk of infection.
Charlotte Pride is in a couple of weeks. We know, as you alluded to, this is disproportionately impacting the LGBTQ community. What is being done to make sure that that event which is usually one of the biggest events in Charlotte. The parade is the biggest parade in Charlotte. We're talking about tens of thousands, even 100,000 people. Is there a way to have that event and be safe?
Absolutely. So we've been working. I started working with the president of Charlotte Pride just about a couple months ago, again, as a part of our preparations. And we talked quite a bit about planning, but specifically outreach and education. So monkeypox is very different than COVID-19. And so I want folks to understand that very clearly. COVID-19 is predominantly spread through respiratory transmission, and transmission is a lot easier with COVID than it is monkeypox. Monkeypox is almost always symptomatic, and unlike COVID, back in the early days of COVID when there wasn't as much, when there were people who had COVID with no symptoms and were still able to transmit it. So we've been working to proactively prepare for Charlotte Pride with their leadership team, making sure that they have education and awareness available. Our teams will be out on the ground that entire weekend in the mix and working, and we'll be offering vaccines during the Pride event as well. But we're also working right now because, of course, we're focused on containment. That's a couple weeks out. And so we're trying to get all of the high-risk patients that we can possibly get in to get vaccinated. And, of course, our communicable disease team is working diligently at contact tracing every confirmed case, which is where we're having opportunities to identify folks who were exposed and intervene.
There are some folks out there who, and I'm not sure that that they're coming from the purest of political standpoints, but they say, oh, you know, this is a gay disease right now. It's basically an STI. People are just being politically correct about the way they're talking about this. Why are they wrong?
Yeah, that's wrong. So, you know, monkeypox is not an STI in the sense that it's not transmitted specifically or exclusively during sexual contact or through sexual fluids. And so, in fact, individuals, it's spread through close, intimate contact or close personal contact. Which, of course, if you're having sexual contact, then, of course, you're having close physical contact. But you don't have to have sexual contact in order for you to transmit the virus from one person to the next. Simply by touching a lesion or being in contact with some of the particles or debris from the lesion, as well as potentially large respiratory droplets. So if you're kissing or exchanging lots of saliva, in those cases, you can also transmit the virus, unlike most STIs where transmission requires sexual transmission, so or sexual intercourse or interactions. And so I think that's important because, as you know, we've had our first cases among kids in the country who were exposed by adults. And so it's important for us to recognize that this certainly could be a risk for anyone in the community.
Thanks for clearing that up, and hopefully our viewers are a little bit smarter now that you've explained that. What do you think? I think right now North Carolina ranks 16th in the country for case counts. We know that at least 3 states have declared states of emergency. Do you see that in the future of our state? I know you're at the local level, but do you see that happening here?
So I think it's an interesting question. I think where we are right now in the outbreak, we are managing well. You know, states of emergency allow us in government to take advantage of some specific or special exceptions to procurements and policies so that we can actually get our work done as a response. It also allows us from a clinical perspective to make some modifications to how we deliver care so that we're able to deliver massive amounts of care to a lot of people. For example, allowing nurses to do certain things that they would not otherwise be able to do if we weren't in a state of emergency. Also allows us to use medications or pharmaceutical options, therapeutic or vaccinations under emergency use authorization. At this time, we are not needing any of those particular measures to be able to manage our response. And the scale of the outbreak at this point, I don't believe today would warrant a state of emergency. However, that could change really quickly. As things on the ground change, as transmission on the ground changes, as more counties have cases, I imagine our partners at the state will be making their decisions based on what's happening in real time. And so very well, that decision could change tomorrow, depending on what's happening.
Final question on monkeypox. If you're a person and you fall in one of these vulnerable populations that are targeted, men having sex with men, that sort of thing, what do you need to do in order to get this vaccine here in Mecklenburg County? Get on the wait list?
Yeah, so the best thing you do is get on the wait list. The wait list is at the mecknc.gov website on the health department's page. Add yourself to the wait list, and we are working through that really quickly. Again, it's an active wait list, so as appointments come available, we're slotting people in and taking them off the wait list. And if you have questions or concerns, specifically if you have any concerns that you may have been exposed to monkeypox, or you're concerned that you may have monkeypox, please give us a call or see your provider. You want to make sure if you have any symptoms, any signs or symptoms, and that includes flu-like symptoms or unknown or unexplained rashes or lesions anywhere in your body, particularly in the genital areas, you want to have those checked by a provider, and the provider will let you know if you need to get tested. Of course, get tested, and if you've been exposed, we want you to get vaccinated.
We'll pause the interview there, and on the other side of the break, we're going to talk COVID here in Charlotte.